Right, Rachel, thank you very much. And on the COVID-19 front right now, there's a lot going on today, including Dr. Anthony Fauci giving the green light for kids to trick or treat this Halloween, plus Merck asking the FDA to authorize its pill to treat COVID. And to weigh in on it this afternoon, we're talking to Dr. David Banach with UConn Health. Thanks so much for joining us again, Dr. Banach.
Thanks for having me on.
So Doc, let's start off with that first point. Dr. Fauci saying on a national level that it's safe for kids to go trick-or-treating, obviously an improvement from last year. But if you're a parent, your child might not be vaccinated by the time Halloween comes around. What should they do to stay safe, and is it safe?
Yeah, so I think these are really important questions that all families are thinking about. In terms of the trick-or-treating, I think the main message is with kids who aren't, especially those who aren't vaccinated, is try to keep it outdoors. Try to limit the group size. In terms of masking, really most important if there's going to be any indoor activity. But I think the overall message is to, try to keep things outdoors as much as possible and avoid group gatherings indoors.
Dr. Banach, we're hearing about this dip in cases. We're seeing things start to open back up a bit. Some of these restrictions start to ease. So are we seeing a light at the end of the tunnel right now? Or could we see a spike in cases again, maybe in the winter?
I think, here in Connecticut, over the last couple of weeks, we've seen declining numbers of cases, and the metrics are looking optimistic. But it is still a cautious optimism. I think as we move into the winter, particularly based on what was seen last year, we have to be careful and, sort of maintain that optimism, but still kind of keeping a close eye on some of those metrics to see if case numbers are rising, and we need to adjust our activities accordingly.
One last thing here, for the past year and a half, all we've heard about are vaccines, Moderna, Pfizer, J&J. Now we're seeing some different types of treatments. Merck asking the FDA to authorize a pill form for treating COVID-19. Can you just explain the the effectiveness of that pill form, how it works differently in our body if people haven't gotten a vaccine yet? What might be a benefit of taking a pill instead of a shot?
Sure. So, I think the main message is that the vaccines are really the primary way that we're going to prevent COVID and spread of COVID throughout the community. But in terms of this oral medication, so the FDA is reviewing data from an oral antiviral medicine that Merck submitted, which basically is aimed at preventing the progression of individuals who are infected with COVID. So think about folks who have mild infection, and this drug was effective in preventing progression to hospitalization and mortality. So, I think that's going to be the goal of this particular medication. It's an oral medication taken for 5 days with the early onset of symptoms, particularly in those who are at high risk for progression, in order to prevent that progression from occurring and requiring those hospitalizations. So, I think another part of our armamentarium in battling COVID, the vaccines are primary, but this is another way that we can, help prevent the impact of COVID on all of us.
Dr. Banach, always appreciate your expertise. Thank you very much.